Thanks everybody for joining. Eric and I are certainly excited to be here on behalf of MOX Networks and appreciate Atlanta Convergence having us out. Here we're going to talk about digital infrastructure and its effect within the healthcare industry. Our company in particular, MOX Networks, is a company under one gentleman's ownership and his family office, Dr. Patrick Soon-Shiong. Dr. Patrick Soon-Shiong co-founded MOX alongside several of us within his family office in 2013 with the sole goal of growing the infrastructure within the healthcare industry. He saw a very distinct problem that was ongoing within the US and around the world of being able to obtain the kind of bandwidth needs that was needed for big data. And if all of us remember the time of 2012 when this was in development, dark fiber wasn't something a lot of us could go and acquire with ease. We were out there trying to source 100 meg circuits, 1 gig, even 10 gig was a very new technology. 40 gig had just come out. Nowadays, we're talking about multiple terabits flowing down single line systems with DWDM. DWDM and ROADM technology was still brand new. Infinera had just come out with their new items. WaveLogic was in its infancy with Sienna. So we were now at this infancy of what the big data problem was going to become. Patrick had the foresight to see he was already experiencing a very big data problem. And it was a very expensive big data problem. And his background in particular was he was growing up in an age of developing drugs and developing net new technologies. So with over 50 different companies under the family office umbrella, and as one of the world's richest people, he has the ability to invest in not just technologies, but infrastructure that help drive the world forward. And having that luxury and that benefit allowed us to take MOX and grow it into what it is today to support what his goals are in preventing the ability of some telecommunications operators in the past to prevent growth and expansion for what he knew to be the end goal. Patrick in and of himself made his fortune and a lot of the initial waves of building out a company that many of us are familiar with called Celgene, Abraxas Biosciences, Fresenius, and of course, one of the miracle drugs that many of us have received if you went through cancer treatment in Abraxane. Abraxane is a very famous drug that's treated many breast cancer patients and across the globe is one of the most prescribed drugs on the planet for immunotherapy. We're very blessed to be a part of a team that gets to help grow this on a global fashion as we get to grow his network and help to realize a total cost of ownership model that is very akin to something seen in a hyperscale community. In fact, when we built this company, we helped design and build collaboration models with many of the largest companies to say, we want to partner and grow with you and alongside you because we experience the same problem. We can't get the kind of bandwidth we need. We needed, in the infancy and the first route that we ever designed in the United States was between two major metropolitan areas, Chicago and Seattle. And between to go 3,500 miles, over 5,000 kilometers, we couldn't get fiber. It wasn't being sold to us. We wanted to buy a product that no one would sell. And Patrick was willing to say, this is wrong. I can't get the amount of bandwidth I need, and I won't stop the research I need to do, and I won't stop the drug development I need to do. So what do I need to do? I need to build a company that's going to go build fiber. I need to build a company that's going to go build data centers to store my data, because I can't go and do that. So we founded MOX and helped us grow that business. And he had other businesses within the photonics space. He's had other businesses in the data center space to help grow and revolutionize those areas because he won't be stopped in drug development and he won't be stopped in medical research and we won't be stopped in any area that we want to go do. And that includes AI and ML. We own some of the IP that was behind a lot of the original machine learning protocols that was with, I'm sure many of your children probably play Pokemon Go, or what they've been able to do in some of the other areas within AI and ML. We've been able to do a lot of the visual recognition software and be able to work with some of the biggest AI companies on the planet to help them grow that and use that IP. This slide here is something that's very near and dear to Patrick Soon-Shiong's heart, our owner. This is what he calls the rocket ship. And this is where the entire healthcare field really come to mind as you're looking at it from an infrastructure lens. And where you see MOX and where you see other telecommunications companies and where you see the bottom base layer all starting to come together in supporting the end mission of better outcomes. Because what matters to everybody in this room and matters to Eric and myself are better patient outcomes. Our loved ones when they go to the doctor, when we go to the doctor, when we need to be sought. What happens? How do we get seen to get to a better outcome and use the best technology? This chart shows at the bottom how our insurance companies, how our researchers, how our medical providers, how hospitals all interact and combine with everybody going up the stack, whether it's a data center, whether it's a field going for network research, whether it's getting into an AI model, whether it's your radiologist, how we store that data, how the cloud comes into play to bring that to payers. All of that is represented here, and I could spend an hour just talking you through this slide, so I won't continue to waste it, but hope that we get another opportunity to continue to talk about it, because it's an opportunity to show everybody how the medical world in and of itself can play within all of our industries. When we talk about it as a big data problem, we start to get into network. And this slide, I think, is really intrinsic of how the data explosion has grown within healthcare and everything we've seen within AI, everything we've seen within cloud computing. When we think about clinical research, we've seen that grow just exponentially. 100 gig of data per year in imaging and healthcare records per patient. So if I'm going in for a medical record, we've seen this growth from a very small file on an X-ray to massive filings. We are not even talking yet about genomic research and how we're going to take genomic research and start to use it in compare and contrast. One example I like to give people that we've put out into the marketplace with genomics, we use Illumina machines. And we partner with Illumina. If any of you have heard of them, they make the world's best genomic sequencer. And it kind of looks like the fanciest fax machine you've ever seen, but there are rooms full of these devices that are taking genetic data from each of us and then taking a genomic sequence of that data. And that data would take up rooms in a data center. And what we're doing now is we're compressing that into 50 to 150 gigs per patient per scan. But we can't just rely on one scan. We have to take that one scan and then compare it. So I had cancer several years ago. When I had cancer, what did we do? We took a piece of my healthy tissue, we took a piece of my cancerous tissue, and then we had to look at them both individually, 150 to 50 gig per sample. Then we had to look at them together, and we call that Bam Bam. And within Bam Bam, we're taking now all three and combining them. So if I have 100 gig, and then together it ends up being 300 gig in a combined compare and contrast, I have now hundreds of gigs of data just for Justin, just for one sample. Now we take everybody in this room. Now we take that on every time you need to do a compare and contrast for a healthy and non-healthy piece of tissue. Doesn't it have to be cancer? What if it's the next COVID? What if it's the next disease that comes about that we want to look at tuberculosis? Whatever it might be, we have to do that hundreds of gigs at a time. And what do we have to do with that data? We have to store it. We have to transport it. We have to be able to analyze it. And all of that takes our data centers and our network. And if we're not doing both of those things in a scale at which we are not doing them today, we're doing everybody in this room and the future generations a disservice. That will take immense amount of growth, an immense amount of investment that we'll talk about here momentarily. This slide gives everybody, I think, a good opportunity to look at what we're doing from an imaging standpoint and the workflow. So I like to look at, okay, you're looking at a decision-based workflow, how a cloud today, the imaging that's performed, where we're inserting AI, where we're inserting the radiology review, verification, and of course the decision-making that's happening with your doctor. This is the infancy of where we want to get to, but at the end of the day, this is being done in very few places. Only the biggest hospital systems, only the countries with the most amount of money to be able to spend on these processes. This should be democratized. This should be where we want to get to. But to do this, we need network to support it. And going back to where we started, the network is not there. We design networks to never have anything like this in mind. Just like when we designed networks before cloud, before AI, we weren't talking about utilizing 1,000 count fiber. We weren't talking about utilizing full conduits for one customer. That was never anything of anyone's comprehension. We were putting 288s in the ground and going, that's enough, we'll come back to you in 10 years. We're blowing through that in a week. This is utterly at a scale at which we were not prepared for investment. And the one thing I see as a board member here and other places is we are not investing in the network. We're investing in AI at an exponential rate. We're investing in data centers at an exponential rate, but we're not investing in the network, the underpinning, the water pipes, the electricity pipes that go into ensuring that all of these amazing cures and patient outcome can happen. None of that investment is taking place at a scale at which we have to make these advancements. We could talk about AI, we can talk about machine learning, we could talk about radiology and getting better patient outcomes, but without the network to interconnect all of these places, making it seamless, low latency, and low cost to the hospital, that's something they can absorb at a hospital system level without causing all of us as patients to have to feel that, we're doing our next generation children a disservice because we will not have better drug treatment. We will not have better patient outcomes for people like me that had to go through sickness. We won't get there. I got lucky. I'm not sure everybody else will going forward. We have the ability to do this, and now is the time that as the banking community, as the investment community, as the carrier community, we need to collaborate and get to a place that can drive this forward because the data sets are just growing. From a data set standpoint, this is just the medical imaging market. As we look at it in the United States, I'm not even talking in the world. So as a small subset of what we are going to be able to do in the US simply with imaging, this is the exponential growth that we are seeing and how AI and ML is going to begin to play in the data. We are not prepared for networking at this scale. We are not prepared for cloud computing to be able to support all of this. This will need to be done differently. This will need to be done individually to support the level of growth that all of us know and want to achieve. When we think about the dollars being spent, it's great that we talk about everything else. Healthcare is outpacing network investment. AI, of course, I could, without even talking about it, everybody else today has talked about AI, and we will talk about it over the next 2 days. This level of spend in healthcare and what is happening with the data that's being put off, I don't even think we're fathoming this even enough. It's already to a level I can't even think about, $250 billion, but I think it's more. Because this is the amount of money that companies are expected to make and the value of what that data set is. How much more could this be if that data set wasn't stuck at one data center in Ashburn, Virginia, or in Slough, or in Lisbon? What if that data was democratized and had free flow and ability to move between countries, to move between cloud computing platforms, to move between hospitals, to move between researchers? What if the researchers in Wales could actually easily access the information that was being done at UCLA Hospital for cancer research? Everybody in this room thinks it should be that way, but it isn't. And this is the amount of money that the industry thinks is going to be made off of that data. And that needs to be supported at a grounds roots level. And this is the opportunity for everybody in this room. This is the opportunity if we look to make investments, where is the ball going? Where is the puck going? This is where it's going. Everybody having the ability to utilize that data, spend the money wisely. And this is where we want to be spending it. This just further encapsulates the capacity drive. How is our capacity in the US from an internet traffic growth? And to think that this isn't happening in healthcare, and this isn't happening beyond, and driving the use case for big data as more of a reason why Dr. Sunshang set aside and said, I have to do this. The carrier community isn't doing it for myself. I have to do it for myself and then empower others to do it. And that's really a lot of what MOX's purpose has been. We want to do it. We want to do it with others. We want to do it collaboratively. And we want to grow as an industry to empower network investment. And now I really want to introduce Eric Hall, who's going to now take us through a little bit more of the network and the intelligent network design that we're seeing for AI and how that's going. Eric?
Thank you, Justin. Yeah, so now we've heard the roadmap of how we implement the infrastructure to support big data. And based on our experience in the healthcare market and what we've done, we've noticed one thing is that the core infrastructure stays the same. I guess I'd have to switch it. The core infrastructure of dark fiber channel and wave services stays the same. We still need the dark fiber in the ground. We still need the DWDM systems to light the fiber, to sell the channels, the waves to the end customers, depending on their ability. Dark fiber needs, as Justin mentioned earlier, have gone up 2 times, 10 times what they've been in the past. Wave services and channels are no longer multiple hundreds they're now full systems, multiple systems, diverse systems. So that's a large issue to solve. And based on those numbers, we have to, our important piece is operational efficiency. If we don't have the operational efficiency at those numbers, it makes it really tough to keep track of and to implement. So that includes automatic cross connects. That includes real-time OTDRs on the systems to be able to monitor what's going on in real time. Anytime there's an issue, you can implement out and find out what's going on, solve the issue. Especially with, your WaveLogic platforms reaching up to 1,600 gigs. It's large amounts of capacity. I'll run to the next one. So not only does that infrastructure work from a terrestrial perspective, it's now gone global. So customers are looking for end-to-end solutions, not just a piece of, say, Seattle to Chicago. They want to take that Seattle on to Japan. They want to go end to end. They want the full reliability from you. We're seeing subsea rates now, instead of a few hundred gigs as well, going to full fiber pairs and multiple, sometimes 2 fiber pairs diverse from each other. So, and one of the reasons, let's see, so how we've implemented this going forward here's an example of a Seattle to Vancouver to Tokyo. This is one of our routes that we've implemented to support the healthcare and the big data. Big data to us as a network is healthcare, content, AI. It's all the same. It's all network to us, and it's all infrastructure that we have to put into place. And this is one of the routes that we've done that on. We started off with, I think, a half pair here, and we're now up to 2.5 just on the demand from big data. It's growing exponentially and appears to keep growing. One of the other routes that we've done is this route, the South Atlantic route, that's going to go down from Myrtle Beach to Praia Grande. And of course, one thing I forgot to mention on the other one was these are end-to-end routes. So we're not just doing the subsea to support that. We have to support a New York, an Ashburn, an Atlanta, all the way to a data center within Brazil or the endpoint. So that way our customers don't have to do piecemeal together. So we'll put it all together at once. So in the future, we plan next year to be expanding across the U.S. to the Atlantic, to Portugal and Spain, and look forward to extending end-to-end for other customers in the big data to be able to support the needs and the infrastructure that's there. So that's covers how we're handling this from a network perspective. And if I missed anything.
No, I think that's great.
So thank you. We look forward to seeing you next year on with more capacity and how we've handled the infrastructure. Thank you.